My grandpa and my dad are probably the most humble people I know. They would never express their levels of accomplishment. Truly, what pioneers they were in the eye care field. I knew that that was something that was truly different about our family.
What was it like having a daughter like Dr. Deb? It was just a challenge.
She was an individual from the time that she could talk. And there were people who were saying, why can't her parents handle her?
It was just a matter of trying gently not to get in her way. When she wants to do something, she does it to the best of her abilities, and that turns out to be excellence.
There was a need in Sierra Leone, in West Africa, on the coast. And that's where it happened. We were doing all this general surgery, but there were people that were sitting around who were blind. That really touched our hearts. So I wrote a letter to an ophthalmologist friend. 6 weeks later, I got in the mail a little package. In it was a set of eye instruments and a little book, How To. Floodgates were opened. People came from all parts of the country. Each year, we would go back for 3 months of the year, and we did that for 30-some years.
We landed in Sierra Leone. My older sister was with, my dad and my grandpa were with, and we got to the clinic. And I just remember assisting my dad in cataract surgery, just to see the amount of need and how my grandpa and my dad just stepped right in to help those people was just unbelievable. It was that moment that everything just fell into place, and I knew that that would be my career.
Of this one right here, look at that one. How about that? Look at that. That's Deb, Dr. Deb. How nice.
I actually remember that. I had watched my grandpa, I had watched my dad go through this amazing career in my hometown. We knew it was very natural to consider coming back home to Minnesota.
Well, you can't imagine the celebration and the joy that both my father and I experienced. We knew of her intellect, we knew of her drive, and we knew of her compassion for people. There indeed would be a person that we could trust to carry on the care of the people in the Alexandria area and surrounding area.
Looking back at my grandpa, what he had done with my dad, bringing phacoemulsification to the Midwest, putting intraocular lenses in that were a little controversial at the time, it dawned on me that my big dream to continue with excellence was already instilled in me. Continuing to give patients here in Alexandria world-class eye care was really exciting to me. We decided that to really provide the best eye care in Alexandria, Minnesota, and to keep growing would be to build a surgery center. Vance Thompson Vision has always been such a key leader in ophthalmology.
There's no question that Dr. Deb has joined a group that is on the cutting edge of ophthalmology, both technically as well as philosophically.
It's so fun to be able to be working on a team like Vance Thompson Vision and to be working on a team in my hometown with our other eye care providers.
To have a legacy where I'm second of 3 generations of ophthalmologists now, I feel so comfortable that I can pass the baton on to Dr. Deb and know that my patients are well taken care of.
Our children and our children's children have followed the calling and the Christian way, and then it's been so much fun to see them in eye care.
I know I had a calling to be a doctor from the age of 3. I see a legacy of faith-filled generations who loved what they did, who were passionate about what they did, and who added value to others. I hope that I can leave a faith-filled legacy that translates into compassion for people and love for family and friends.